Well, every day 5,000 people die from cardiovascular disease, mainly heart attacks and strokes. It's the #1 killer in the world.
Last year, our company participated in the first summit in Mexico, so I am here today to continue our support in order to find solutions.
We have that big political window of opportunity to really get policymakers to take up our issues, and that doesn't come around very often. So we need to maximise that opportunity with specific action-oriented objectives and priorities.
I thought the summit really will orchestrate the effort of NGOs, industry, academia, government, in order really to improve or increase the awareness on the prevalence of cardiovascular disease, and more important, make cardiovascular disease a priority item on national agendas, and with the objective, of course, to improve patient outcome and to further the goal of 25 by 25.
We want to join forces. We want to work together to get a common message and make sure that in the end governments hear it and take action. So this summit can really help, first of all, raise awareness about the need to accelerate, but more importantly, bringing us all together to join forces and come out with a common message and initiative.
I think this direction that the World Heart Federation is taking, having an annual meeting to bring invited experts together to think about policy, to think about strategy and leadership, this is a real step forward for the WHF. This is an example of the cardiovascular disease community taking itself seriously, really thinking strategically about its next steps, and I really applaud that.
So we believe at Amgen that there is a role around public-private partnerships, and the private sector does have a role to help further the care and the coordinated care of patients and reduce cardiovascular disease burden.
The ambition of the summit was to unite this community, to take common actions together in order to accelerate our efforts to reduce the burden of cardiovascular disease. And in this task, we have made a very important first step. And we would like to thank all of the organizations who sent their leadership to this summit for their contributions. It was a truly inspirational 2 days, and we have learnt a great deal from one another, and we will be able now to act on behalf of our patients, but also populations at large, to reduce the burden of cardiovascular disease. And we look forward to welcoming you to the 3rd Summit on Circulatory Health, to be held in Dubai on December 5th and 6th, 2018, immediately prior to the World Congress of Cardiology and Cardiovascular Health.